we can maybe just start, if you wouldn't mind. I know David will pop in, but can you just talk to us about, how you maybe at the beginning, what did you study? And then even like, what did you start with as soon as you graduated? And then how did you make your way to your career as a VP at Baylor Scott and White? A lot of
Sure.
questions, sorry, but just whatever
That's
you'd like to
okay.
start with.
Um,
Thank you.
it's a pretty interesting, I think, unusual path. Maybe not unusual, but interesting for sure. And actually, one of my biggest pieces of advice for students would be to be open to opportunities that come your way that don't seem like exactly what you thought you were going to be doing. And and actually, the more variety you can have experience with along the way, the better you'll be um, equipped to have a more senior role. So, the days of just a linear career progression with, first you're a worker bee, then you're maybe a supervisor, manager, director, VP, that kind of straight path in one function is probably not the best choice to me. You'll probably be limited, and it probably wouldn't even happen that way. So I actually I was a really good math science student in high school. I was a salutatorian of my high school, and so I went to Brown University, and I grew up in New England, so it's not quite like Texas. And don't ask me why, but I was a geophysics major at Brown, so that's pretty unusual. Um, my dad worked for a bank. He was a executive at a bank in New England, so I was probably just kind of rebelling or something. But the math science, it was like kind of applied physics and applied math, that geophysics degree, and that's what I really found myself being interested in, was problem solving. um, I graduated, and actually I went to Texas A&M for a year of a PhD program in geophysics, and this was, gosh, 1983, 84. So it was pretty unusual to have a girl doing that.
Mm.
So, I was not the most confident person. It wasn't like I was, very full of myself and thought I could do anything. I was just pursuing what I really had an interest in. And I had had a lot of encouragement from my family and teachers along the way, that I felt like I was a good student. So wasn't worried that I wouldn't be able to do it. And somebody in college told me to get out of my comfort zone when I went to grad school, and sort of going from Brown University to Texas A&M was my idea of getting out of my comfort zone and trying something different. I ended up getting a master's degree in electrical engineering, so without a bachelor's degree in electrical engineering, which was, again, kind of strange. I was one out of 50 students who was a female getting a master's, and most of the folks weren't from the U.S. I think maybe 10 out of the 50 were from the U.S. So a lot of foreign grad students and me. I finished it in 2 years, crazy enough. And I was a digital signal processing kind of person. And that is sort of tied to the geophysics, because seismic and digital signal processing are similar paths. So radar and sonar, things like that is what you might do with that type of major, or speech synthesis. I went to work for Bell Labs out of my master's. I worked for Bell Labs in New Jersey for 2 years, and then I moved to Boston. I worked for a company called MITRE in Boston. They're all kind of R&D, think tankish places. I realized my personality was much more outgoing and like out and about and working with different people. So I thought maybe being a research scientist wasn't necessarily the best thing for me. So I started thinking about getting an MBA, and a lot of people that I knew who were engineers were getting MBAs, and that seemed like a good combination. So I was living in Boston, and I applied to different business schools. I ended up going to the University of Chicago. So I moved to Chicago, which was, again, kind of an adventure. I had never been to Chicago. Finished that, got very interested in operations, and finance. And I took a job, it was a pretty unusual job at United Technologies. And United Technologies, part of it is now owned by Lockheed. So if those of you who know Lockheed, Lockheed bought Sikorsky aircraft, which like Bell Helicopter makes Black Hawks, Seahawks, and helicopters. So I went to work for United Technologies, and they had a rotational management training program in operations, which is why I picked that job. So I had many different experiences in that first year, different industrial engineering, manufacturing, purchasing, things like that. And then I ran their development center, which was sort of the odd aircraft, building a couple of these, a couple of those, kind of like new product development over and over again. And then I decided I wanted to run something. So I saw some of my friends getting opportunities, and I didn't see the women getting the same opportunities. And I have never been the most patient person. So I went looking around, and I found a company in upstate New York that was making robotics, and I went to work there. And I was the director of operations with a couple of product lines that were sold globally. And that's when I first went to China, when I worked there. And then after I was doing the manufacturing, I ended up being in charge of the field service for North and South America. So I had 250 people working for me in Mexico, Canada, US, so all different places around that territory. And I was about 34 maybe. And then I was traveling to Mexico, you know, Guadalajara, all the electronics locations. And that's when I went to China for the first time. So that was pretty exciting, and Brazil and Argentina and all of that. I moved from there after about 5 years. I moved to another company where I was vice president of manufacturing, global manufacturing and supply chain for an electronics manufacturer. That's when I was really traveling, and I went many, many different places. I was interacting with the suppliers. I was making all the contracts and agreements for different parts that they were making for us. I was trying to wring the cost out of our supply chain and get better suited suppliers for what we were doing. We outsourced some products to a contract manufacturer in Malaysia. That's when I went to Malaysia for the first time. It was an American company called Plexus. So they were building some of our products in a new plant in Malaysia. And I was the one who kind of did the sourcing for that. And we chose all of our suppliers with them in Malaysia, went to cable manufacturers and sheet metal and plastics. So I got pretty familiar with supply chain and sourcing and contracting, and I basically wrote the contracts. I took a template that I had from a different company and tweaked it for us, and we used that. And for the first time, we were using our own so-called paper for the agreements versus using the suppliers' contracts. Lot of real strategy going on there for like minimizing risk and, you know, making sure that we knew how to build the products there. And that's a little different than what you do in healthcare. But from there, I worked there for 7 years, and then I decided to go back to a bigger company. And I was an executive at Pratt & Whitney for a little while. I had about $1 billion worth of spend on castings, forgings, and nickel, titanium, and all the metals that are in a jet engine. I had the sourcing team and the tactical folks that were getting the parts for the plants. I wasn't really enjoying that union environment too much. It was kind of a little old-fashioned compared to what I had been doing in the high-tech electronics. So I was living in Connecticut, and I learned about Covidien, and I ended up working at Covidien, which is part of Medtronic. Well, it was bought by Medtronic in 2015. So I went into medical device manufacturing. So laparoscopic instruments and different kinds of medical devices. And that's where I was really traveling. So, and that's where I took a left turn into supply chain versus manufacturing. So I had always been either in manufacturing and supply chain or manufacturing. So that's when I decided consciously that I really enjoyed the supply chain piece of it.
Okay.
Because I thought, that's the cost, quality, delivery, strategy is definitely in the supply chain. And it's pretty interesting, to learn about the other countries and different capabilities that people had. So that's when I had the Ireland, England, France, Dominican Republic, Puerto Rico, Costa Rica, all that. And I would go to those different plants and we'd look at how much inventory they had, figure out ways to control the inventory, the quality of the materials, the strategies with the suppliers. We had a distribution center, a big global distribution center in Indiana or Illinois near the O'Hare Airport. So we were responsible for the planning of the materials to replenish those materials in the distribution center and make sure we had the right fill rates. And I like that a lot. I really enjoy the planning piece, the material planning. I think it's really interesting. And so after that, I went to work for GE for a little while, GE Transportation, making diesel locomotives. So this is another thing about supply chain. If you really get a multifaceted experience in supply chain, the planning, the logistics, the purchasing, the sourcing, and the contracting, if you kind of get a well-rounded experience with all of that, you could pretty much do it in any industry. There are differences between like chemical manufacturing and assembly of products and plants. There's differences there, but you can kind of take the skills and do a variety of different roles in different industries. So that's one of the good things about supply chain also. But GE Transportation was another heavy union business. Their items had like 52-week lead times, and they were building products basically to order, engineering to order for international customers. There's different track gauge. Anybody who's into railroad, an international locomotive is going to be pretty much custom. But in the U.S., if you look around at the Union Pacific and CSX and the ones you see running around Texas, those are all pretty similar to each other. Those are more high production. And they had a plant in Texas, in Fort Worth, that I was responsible for. A couple in Mexico, Afghanistan, India, Pennsylvania. So there were plants all over the place. So I was responsible for all the materials there, about $1 billion worth of parts and inventory. So if you know about GE, GE broke up and they actually sold off the GE Transportation to a company called Wabtec. And if any of you live near Fort Worth, you probably know all about that. About the same time, Baylor Scott and White actually knocked on my door and they were looking for somebody from supply chain with expertise in many different industries who could come into the healthcare space and take a look at how they were doing things and try and transform it into something more modern. Healthcare supply chains and hospitals particularly are pretty well known for being somewhat antiquated and insular. So there's been a lot of people from healthcare kind of only working in healthcare supply chain, so not a lot of infusion of new ideas. So they were pretty forward thinking and looking for somebody to help transform their supply chain and get better agreements with the suppliers, like the Medtronic that I had worked for. Look at how they were managing inventory. We have Baylor Scott & White has a distribution center down in Temple. If you drive down past Waco, sometimes you see Baylor Scott & White Logistics on a big sign. We had 27 hospitals, 700 clinics. So I was responsible for all of the material for all of that. So anything anyone would need in any hospital or clinic, and that includes paper, furniture, medical devices, contracts with like valet parking services, you name it, any service, any product, any tool that they use, different IT arrangements, you name it, just it could be anything that's needed. Like a university, whoever's in charge of the supply chain for UT Dallas is buying chalkboards and garbage services and whatever you might need, office furniture, anything, the buildings themselves, construction, all that kind of stuff. So I just retired recently. I was also responsible for all the PPE for COVID, with the spikes in COVID patients, from going from 0 to 100 miles an hour in 2 seconds, and then not knowing what was going to happen next. That was a pretty interesting challenge.
Wow.
But I think everything that I learned along the way has helped me with everything that I've done. I have a broad set of tools and concepts and things to draw upon and size up the situation, look for where the opportunities are. Now in Baylor Scott & White, there isn't so much travel. It's more driving around Texas than it is going around the globe. But some hospital systems do have a presence in other countries. So that's not necessarily going to be a problem, or a constraint there. But usually with the healthcare systems and the hospitals, it's pretty much a local facilities, and you might be working with global suppliers, though. However, so
Wow. I am blown away. I don't know if anybody else on the call is, by your path. There's a student comment on here. She says, your path is so inspiring. I have a non-traditional educational background in biochemistry and currently work in healthcare sourcing contracting at Vizient. Sorry.
Oh,
it's
yep.
awesome to hear how many unique opportunities you've been able to tie together.
Yes.
Wow.
And I think the more you can get into other areas of supply chain, the better off you are. Sometimes people that are in one part of it don't necessarily have the skills to be in the other part of it, and they need to build those skills before they get too senior. So, it would be hard for me to get a job now being a marketing vice president, right? Because I haven't really done the work to prepare myself for that. But
I have no doubt you would be able to, given what you have been able to do.
But for somebody who's in sourcing and contracting, in some companies, you don't necessarily go visit the suppliers. It's more administrative or negotiating. But the more you can see the suppliers' facilities, the more you can learn about their whole supply chain and what their costs are based on, and what their pain points are. The better you can negotiate. So I think people that are in sourcing and contracting, it's good for them to get into the logistics or material planning or supplier quality elements, so they can sort of understand the whole end to end. Then you can even negotiate better. You know what their costs are based on. In some of my past experiences, I was buying parts to make products. In healthcare, people are all buying pretty much the same items from the same suppliers, and it's all sort of off the shelf. It's not really custom, so it's a little different. But if somebody was making something specifically for me, I would know what's going into that process for them, so that I could understand, is it labor, is it material, is it a particular type of material, is there platinum in it, or is there some expensive component that's causing the price or the lead time to be longer. Then you have a better time getting to some kind of mutual agreement that helps everybody have a win-win. The more you understand about the whole supply chain and all the whole process that goes into it, the better off you are. So anybody who's in planning or logistics, I would encourage them to take a spin through sourcing and procurement. Anybody who's sourcing and procurement, I'd encourage them to take spin through the planning and logistics, so that they really kind of understand, or go from a supplier company to a manufacturing customer type business and understand both sides of that. That really gives you a lot of background, to make good decisions and more deeply understand the business situation.
So if we've got students on the call who maybe are just kind of starting out and maybe they might just be, kind of the basic business administration major, and they're wanting to kind of build this career in some of the things you've talked about. What recommendations do you have as far as experiences, maybe in addition to the classes, experiences that they should try to get while they're in college, whether that's undergraduate or graduate?
So some of the best courses I ever took were actually when I was in my MBA was the strategy. I think they called it business policy. Um, and there was I don't know if this book or this concept still used today, but the Porter model, where you have to kind of think of the forces, the 5 forces in whatever industry or whatever business it is you're working in. I mean, to this day, I use that framework to like think through what's going on in that business and like what kind of repercussions or reactions there might be to an action, or what the competitive situation is across the players in the market. I love to read, I actually read the Wall Street Journal, I read business magazines. I read a lot. But if you have a course that has business cases, I think that's really valuable because you have to kind of think through what decisions are people making and what data do they have to base the decisions on, and I think those are all the real world, and the business world is all about thinking about those chess moves, and the different outcomes depending on what different players what they choose to do next. It's so I think it's fascinating. And when I was an engineer, it's much more like 1 + 1 = 2. It's not so open ended. So I think the business school experiences teach you better problem solving with open ended situations. And you'll never have all the data and you never have all the time in the world, and you have to do the best you can to make a decision. So those types of classes that teach you problem solving or case studies or some kind of data analysis courses where you kind of learn how to boil down a situation into the key elements. It was very rare that I used tons and tons of data to make a decision, or took months and months to make a decision. I'd kind of think about what the key pieces were, and then I'd either have the data myself, or I'd have somebody that worked for me put together some trends or some details that we could peel back to kind of make some choices. But those kind of classes would be great, or even a project, do a project with a local business where you can really put your arms around a problem and try to figure out what you would do. I had a really interesting class when I was in business school. We did a project with a team with a local company to improve their efficiency of their whatever they were doing in their business. And that was that's what actually really energized me to go down the path that I went in with the operations.
Wow. I'm putting in some little notes here of things you've said. And if anybody, students, if you think of something, stick it in the chat. This chat exists afterwards too, so it's kind of nice to have some memories of what we've discussed. And let's see. So David says, I agree with Quincy. Strategic management is a great subject for multiple industries.
Yep.
And he teaches, so he's a good person for us to talk to.
And I want to apologize for being late. Hi, guys. Sorry about that. I had a meeting that ran way over that was not supposed to have gone over, so I apologize. But you guys have the expert talking, and Pam and I have worked together for years, and I think the information that she's been sharing with everyone on this has just been spot on, particularly when you look at the healthcare industry. But I think overall, as you listen to what Pam was talking about, it can apply to a number of different industries as well. And I think absolutely the discussion about the strategic management side of it, whether you do, like in our graduate programs on the supply chain side, we have a specific course designed for strategic supply chain management, Or on the undergrad side, look for those courses that have a discussion of strategic management. We have one of the best instructors, actually well noted, that teaches strategic management, Greg Dess. And I've worked with Greg in the past and actually used quite a bit of his material in my courses. So yeah, I couldn't agree more with what Pam and Quincy were talking about from a strategy standpoint, regardless of the industry that you're in. I'm a supply chain guide, so one of the things that is being looked at right now, particularly on the retail side, is what should our strategies be? We're kind of scratching our heads in the retail industry right now, saying what's the role that stores play anymore? Brick and mortar locations, do they have a role? What about the combination of the intersections between stores and physical distribution sites? Do they come into play? I've been fortunate enough that Pam's opened up the DC down in Temple and been through that, and it's quite an operation. And I know the gentleman that runs that, her friend Julio Carrillo, he is more than happy to share going through that site. But I mean, thinking about that from a strategy standpoint, where does that play into supporting all of the organization from a healthcare standpoint? Some of the and Pam, I don't know if you're doing this in the healthcare, but one of the things we're talking about is more collaborative arrangements using a unified strategy or assets. So if you guys here on the session had seen, Walmart is going to be delivering for Home Depot. Well, that's a joint usage of the supply chain assets that they're using. The company I came out of, Designer Brands Inc., we did the exact same thing. I think we're going to see some more collaboration like this across the board, particularly with some of the challenges and opportunities that we're facing in supply chain. So absolutely a great time to be interested in supply chain, whether it's healthcare, electronics, or retail, or wherever it is.
Well, it's just like what you mentioned, there's a focus on home care in healthcare, and just as Dr. Whitterfield talked about the bricks and mortar, same thing applies to a hospital. Big hospitals, if they're not full of patients that are kind of generating the right revenue streams, hospitals have to take patients that come to the emergency room, whether they have insurance or not. So, it's a little bit of a disadvantage. They can't really choose their quote customers, but there's a lot of focus on going to virtual health, and doing different doctor visits through your computer, and having monitoring of your vital signs and things like that. So to avoid having people go to the hospital, they're trying to reinvent that whole thing too, so that the bricks and mortar are actually used for the most necessary procedures, versus an ambulatory care situation outside the hospital that you come in for the day surgery. So, it's all trying to be most efficient and most cost effective.
Well, that's going to be my next question. We have a lot of talk in our classes about telehealth and, the implications of that then on the supply chain world and the brick and mortar hospitals. And so what do you see? Do you have any predictions on how the increase of kind of telehealth or virtual health will impact supply chain and healthcare?
Oh gosh, absolutely. And not every hospital system has a distribution center. That's not necessarily common. Only the very big hospital systems have such a presence with a distribution center, because there's a lot of overhead, involved in the inventory, carrying costs, and all that stuff. But we're starting to have more of that home-based healthcare, including telehealth. And it doesn't necessarily mean everything has to be sold through our brick and mortar. It could be more drop ship arrangements. And actually, we don't have a capability in that distribution center to make a sale, sell products from that distribution center. That's not how it was set up. It's set up to kind of issue material out to the hospitals. So there isn't even like a sale transaction there. So to do something like selling or using that facility for multiple customers, let another hospital system leverage that facility to do its own business, you have to be pretty sophisticated. It's almost like being a contract manufacturer. When you're a contract manufacturer, you have multiple customers, they could all be using the same items, but the items have different part numbers and they have segregated inventory to, take care of each customer. So there'd be a lot of learning to happen to do that. I think they'd actually have to hire different people with different expertise to actually execute on something like that, because that's pretty far from the core skill set of today's healthcare supply chain folks. It's probably people from different industries, maybe even retail or something like contract manufacturing. It's pretty sophisticated, and you need the right systems to handle that too. I mean, we had pretty basic systems, so you'd almost have to implement a model from another industry to handle that.
So it sounds like lots of career potential, which is what we're talking about today.
Yes.
Yeah, that's good. So there's a question. This isn't even anything. This is just based on your experience. It says, throughout your career, how were you able to deal with difficult situations or mistakes? And how do you break down a problem that involves several people under your supervision? That's a good question.
So how to deal with something with several people under my supervision? I mean, I would probably just be very direct about it and bring them together to brainstorm and discuss the problem. So that's I would be much more likely to be direct about that and not sort of try to work with each one of them and try and figure it out myself. I'd bring the group together. Handling uncomfortable situations is probably something that you really have to learn to do, and probably one of my pieces of advice would be, if you feel like you're getting into a difficult situation, pause, take a pause, take a little time out and don't react to it. A lot of people, when they're earlier in their career, they might take something the wrong way or read something into something that wasn't really what was meant and kind of react out of just human nature. I think it's always good to stop and consider what's going on and figure out a way to approach it that's sort of non-threatening and isn't kind of assuming some ill intent. I have on my signature line, actually, this little slogan called "Assume Positive Intent," which I picked that up maybe 8 years ago from another person who had come out of the military academies. Sometimes when you have a new boss or a new leader, they kind of mention their top 10 rules to live by or values or something. No surprises is usually one of them, but this guy had assume positive intent. And I think that's really important, especially with emails and video chats. I mean, it's so easy to misunderstand what somebody says to you, or, people are coming from different backgrounds. They're not necessarily sitting in the same place all the time these days. If there was no video, we wouldn't be able to see each other's faces. You would maybe take something the wrong way. It's just good to step back for a second and assume positive intent, and maybe there was no problem in the first place. That's sometimes emails are very hard to interpret sometimes. And reply all can cause a catastrophe really fast, so.
We've had that at UTD where there's been a reply all to the entire campus. That could be like 28,000 students.
So I have a funny story to complement what Pam just said. So when I was director of logistics systems at Designer Brands Inc., I was chastising a supplier, and because the supplier had failed miserably, it was a software provider, and I was basically chastised and said they need to fix the problem. At the same time, I was responding back to my boss, who was the senior VP for logistics distribution. And I was telling him and the IT, the CIO, how horrible this company was. I said, they're absolutely worthless. They're trash. Their product is absolutely wrong. We need to scrap this as soon as humanly possible. I hit reply all. The CEO of the software company was on that, as well as his senior VPs. Wow. Yeah, I had to do a lot of backtracking and humbling eating crow, and because it was just their product, it wasn't the entire company, but I just ripped the company apart. And Yeah, absolutely, Pam. Don't hit reply all.
No,
So back to this,
sometimes I've rewritten the same email, 100 times on some occasions, depending on who it's going to make sure I could kind of see how it sounded or show it to somebody else. How does this sound to you? You got to be a little careful.
Yeah, you do. Absolutely.
that is
So speaking
great.
of difficult situations, yeah, those are tough
And if you don't have
situations.
those, how do you ever get better, right? Or grow
Yeah,
or pay it forward?
exactly. Exactly.
Well,
Oh
we have
my.
about 5 minutes left. So, we'd love just to hear from both of you. What are some advice you would give, for students who maybe don't have any experience in supply chain, but they are inspired to do so? So, whether they are getting ready to graduate or they're just getting started in whatever program they're in, how can they maximize their time now? And I guess, what kind of experience would you advise them to get at this stage in whatever career, part of their career that they're in?
I'll let Pam go.
Well, I would try to do something that's very hands-on. Sometimes a role in a customer service function can teach you a lot about the business. You can learn a lot about the products. You can learn a lot about the problems they're having with the products. You can learn about the customers. You can learn about their culture and different functions. So sometimes, tech support or customer service, sometimes those roles aren't the ones that people are sought after, but those are good learning experiences, and you can come out of that learning some project management. I always look for project management and communications skills, leadership skills, like the ability to take a team and just organize a group of people to make something happen, make something come true. Roles where you have those kinds of opportunities, I think if you'd get a role where it's like one project, that might be a little limiting because you're kind of getting one little slice. The more you can be part of a team, and get some customer facing, maybe it could be an internal customer too, like expediting parts. That sometimes sounds terrible, but that you can learn a lot from doing that about the systems and the data and the customers. Those are good entry level kind of roles. Maybe a buyer role could be interesting. You'll learn about the system, you'll learn about the products, you'll learn about some of the problems that people are having. Nothing's forever, so it's kind of like, as long as you're learning something that's, of value to the bigger picture, get some visibility with, make relationships with people too. Like don't sit there and speak when spoken to, get some one-on-ones with different members of the management to understand their viewpoints and things. Those are good things to do.
Mhm. And to
Very
add
wise.
to what Pam was saying, I would say that as you're looking at your career, be open to horizontal movement within your organization. As Pam just mentioned, do customer service, do procurement buying, go into an operational role. A lot of times, and myself included, we make the mistake is that we only look vertically. So we're only looking at what the next promotion is. But oftentimes, back to Pam's point about get some face time in front of people, if you're willing to move horizontally within your company in different roles and different areas, you get to meet different areas of the leadership of the company. And what's really nice, and I tell a lot of my classes this, is that like on our first session, is that by doing that, you're broadening out your skill sets. And by broadening out your skill sets, when it comes time to do talent review, I can look at somebody who spent 5 years in, let's just say, distribution operations or inventory management. But yet I look at another person who's done 5 years and they've done inventory management, distribution operations, customer service, you name it, and they've got a vast experience. I can use that person a lot better in the organization when I'm doing these types of promotions and succession planning. So absolutely, something that's helped me along the way is I was one of those weird people. I always volunteered to go to other assignments just to
Yep.
learn the business.
And David, that's what I said like the first 5 minutes of the call, because even when I mentioned that field service role that I had with the North and South America and all those
Mhm.
people, I had never thought that I would do that, but I was out with customers, with sometimes angry customers whose products weren't working properly, but I learned so much about the business from that experience, that I never would have thought of that myself, and I took that role. They offered it to me and I said, you know what, I could learn a lot from that. Nothing's forever. So
yeah.
I think that's so wise. It's that theme has gotten brought up all week so far. We've had several different themes for our career week. And every last one, the experts on the call have said, nothing is forever. What you're doing now isn't what you'll be doing in 3 years, 5 years. And that's a good thing. Giving yourself some time and space to kind of figure it out, and then also exploring options. So having just tunnel vision maybe is not the best thing, as you have, the career field is so broad and it is a field versus just a path. So I think all the things you all have said, I stuck a couple of these little pieces of advice in the chat. But I think this has just been so beneficial for students as they're considering this. So thank you all so much.